This morning on The Real Story, we're digging in deeper to the investigation and call for action after an audit said state police likely falsified tens of thousands of traffic tickets. State Senator Gary Winfield is joining us to talk about the hearing at the state capitol, how lawmakers are suggesting to fix a system and repair broken trust between Connecticut State Police and their communities. But first, as families get ready to head back to school, Children's Services are bracing for the end of major pandemic funding. We're talking to leaders at the Village about the child care crisis, mental health needs, and more impacting Connecticut families. Good morning, and thanks for joining us on The Real Story. I'm Emma Wulfhorst. It'll be back to school time before we know it. Families already starting to get ready, but before that first bell rings, we're checking in on post-pandemic changes and needs for Connecticut's children. Joining me now is the Village's Chief Operating Officer, Hector Glynn, and Dr. Laine Taylor, the Village Medical Director. Thank you both so much for being here with us.
Thank you, Emma.
Thanks for having us.
Of course. So the Village has so many different services, but Hector or Laine, whoever wants to start off, give me a little bit of an overview about what the Village does here in Connecticut.
So the Village tries to build strong communities. So we help empower and bring the best out of any individual that we touch. So that can start from our early childhood programs, from preschool to home visitation, where we lead a network of 8 providers that service about 2,500 young parents. Wow. And we go into the home and help them understand what parenting is like. From there, we have a division of school-based services. We are the lead agency in 7 of Hartford's public schools. And so there we provide, everything from after-school programming to mental health services to other supports that the school may need. We keep going up, and we have one of the largest outpatient clinics for both adult and children in the state. And so at any given point, we can have 2,500 young families that are receiving services, or 1,500 individuals on the adult side who are receiving substance abuse or other clinical services.
So definitely impacting a lot of people.
Yeah. Across the lifespan.
Absolutely. So let's talk about Connecticut's children and families here. You work closely with so many, as we just said, whether it's in the classrooms or in people's homes. And you're saying there are some real challenges coming out of the COVID-19 pandemic. So tell me about what you're seeing. Laine, we'll start with you and then go to Hector.
Yeah. I was actually fortunate enough to be able to speak with a group this week about this very thing, about how are we in this post-pandemic era. And I think the pandemic is much more than a disease state. It's really about the sort of generational effect that's coming out of what we had to endure during the period of the peak, right? And so as we are going into this era and we're looking at services and looking at needs, we're seeing kids with high mental health needs, lots of anxiety, lots of depression, and a lot of kids who were sort of left behind in the course of their education and their health care as we were trying to figure out this public health crisis.
Right, and anything to add there, Hector?
I would just add, especially within our school settings, that social construct between students, families, and the schools has been broken, and you see it in the attendance numbers. And so there is a crisis in Connecticut. Kids are not going to school enough, and we as a community have to find a way to support that and change that. It can't be all left up to the schools and can't be all left to the families. This is something that really needs sort of addressing.
Sure. So when it comes to funding, especially now post-pandemic, we saw, more spending and more federal funds coming into Connecticut schools, emergency grants, but now most of that is ending or has finished. So what does that mean for our classrooms and teachers this year?
So at the beginning of the pandemic, there was a lot of federal dollars that came into schools and states. And that was great. It helped create some of the supports, some of the programs that are currently in place. Unfortunately, a lot of the philanthropy then left that space. And now there is a big question of what's going to happen when all this federal dollars is gone and sort of the corporate philanthropy is still trying to figure out their role in it. But it didn't just happen sort of within the school settings. You know, one of our newest programs, one that we're most excited about, our Urgent Crisis Center, it's a partnership with DCF and the Village, is funded through some of those COVID dollars. And those dollars are due to expire. So even though Laine's going to work tonight right there and provide services at our clinic, there is a big question around what happens next year.
And so, Laine, Hector, you just brought up that urgent crisis program. So, as you mentioned at the start here, a lot of mental health needs coming out post-pandemic. So let's talk a little bit about that program. What is this Crisis Center program, and tell me a little bit more about this.
Yeah, it's really exciting. It's actually a brand new level of care within the state. It is if you think a little bit about an urgent care that we know from medical issues, it is essentially that for mental health. So for example, if you have an ear infection and you can't quite get to your doctor, you go to an urgent care. You don't have to go to the emergency department. But if you are having a heart attack or something grave like that, you go to the emergency department. The Urgent Crisis Center is like that for behavioral health, for kids. So if your child is in crisis, but they're not an actual direct risk to themselves or to others, meaning they haven't actually harmed themselves already or others, then they can come. They can come into our, as well as 3 other facilities across the state and receive crisis support services. That includes a multidisciplinary evaluation, which includes nursing, clinical, and psychiatric, and then you also get support with discharge planning. So the aim is to help you resolve the crisis that's happening in the moment so you don't have to go to the emergency room, be able to go back home with a plan and next steps for care.
And with mental health, especially coming out of the pandemic, do you feel right now like schools are equipped to handle this? Obviously, you're talking about this new program that's kind of, separate. It's another level here, but obviously students deal with these things in school. Do you feel like schools are equipped at all to handle this?
They certainly try. They try really hard, but across all the different school districts, as well as in healthcare environments, we're noticing kids are struggling more, and they're struggling at high rates earlier on. So when you're just getting detected, a lot of these kids are struggling pretty immensely, such that rather than the first time they touch base with a therapist, they're feeling depressed. They're touching base with a therapist for the first time actually having thoughts of wanting to die. And so the schools are trying really hard, but we need to partner healthcare and education in order to really meet the kids' needs and help bring them back. There was a great deal of isolation that happened during the pandemic that I think exacerbated a lot of kids' difficulties.
And we have to remember that schools are where kids spend most of their waking hours.
Right.
And so they are the alert system. They are the ones that are going to see the behavior. So it would be unfair to put the burden on schools to say, be the surveillance system, be the treatment system, try to help all these children who have, from, the changes in social media to the isolation to everything that they're dealing with be solved in a school setting.
Absolutely. And Hector, when it comes to childcare, going back to that, we're seeing, fewer kids served now because there's so much demand and, not enough providers and high costs. So the Care for Kids program helps with child care costs, but potentially going to have to cut thousands of kids from this program. Can you tell me a little bit more about that?
Sure. So in most school readiness programs, there is a small grant that the state subsidizes the center in order to provide the services, but the rest is on the parent. So either on out-of-pocket or they can apply for Care for Kids, and they would cover the rest of the cost. If you think about a child care setting, it is a trained adult who is helping a child develop the learning skills that they need. And you have to keep a ratio in which you're safe. And you're normally operating from like 7 in the morning to 6 at night. So it's a long period of time.
Right, and so we've talked a lot about some of the issues here. What are potential solutions? And both of you can start with Hector and then go to Laine. What are some of these potential solutions, and what do you both feel the state needs to do here?
So, solutions always, as Laine sort of alluded to, come from partnerships, right? No one can do this alone. And so, we have a partnership currently now with Staples. They are helping us, fundraise for our backpack program. We know that the start of the school year is an area where there's a lot of stressors, with all the, parents who are already financially strapped because gas is going up and, food's going up. And so Staples, you can go to a Staples store, you could go to our village website to make a donation so that we can continue to provide those supports to families. But as far as the states, there is, not this session, but the one before, it was all about children's mental health. It was, bipartisan. Almost every single legislator across the state voted in support of programs in these areas. And we have to make sure that that's what they started continues, that it's not dropped off, and that everyone understands that we're not out of the crisis just because they passed one bill. It's a long marathon in order to repair the harm that's being done.
Yeah.
And I think the role of community organizations like the Village is really crucial because it allows us to provide a voice to those who are least served because we're in touch with them. And allow the legislators and then the executive branch understand what's really happening. Because when we do broad strokes, generalizations around what's happening in Connecticut, you lose the minority who are usually the most affected by poverty, the most affected by poor education, poorer health. And so I think that that's another piece of that partnership is being able to provide voice for those children and families who are struggling.
Right, and this is going on, as we mentioned, in school, of course, but also at the home, Laine, about that mental health piece. So whether a child is struggling or they maybe notice something about a friend, what are some ways parents can maybe start those conversations and give their kids some coping skills or a safe place to turn to in the home?
Yeah, I think actually there's prep before that conversation happens, and that prep looks like spending time, right? And it doesn't have to be, intense time. It doesn't have to be where you're spending lots of money. It's just being with. Because kids harbor and hold on to so much. And infrequently do they actually experience adults expressing an interest in what's happening with them. So when you spend time and you open that conversation in a really broad fashion, that's not pinpointing a particular problem, but starting to just build relationships, that's where you lay the groundwork. And then if you're actively seeing concerns, if you're starting to notice that your child is isolating more, that they're sleeping too much, that maybe there's changes in their appetite, start to have those conversations and understand what's going on in their world. But it's probably at that point also time to get support and ask for the therapist or an additional professional to help you with those conversations.
Well, Hector, Laine, thank you both so much for being here. And I know you brought up the backpack program and a couple other things, those resources, and more for people if they want to take part or find more will be on our website at fox61.com. Thank you both so much again for being here with us.
Thank you, Emma.
And of course, there's still more to come this morning on The Real Story. We're getting insight about the investigation into state police accused of possibly falsifying tens of thousands of traffic tickets. What happened, how will lawmakers respond, and what happens next? State Senator Gary Winfield is joining us coming up.